I'm going to go ahead and get started and let people in as they arrive. Good morning, everyone. Thanks for joining us. This is our third Coffee with Coop session this morning, and our panelist is obviously Dr. Tommy Ibrahim. He's the president and CEO of Bassett Healthcare Network. I left everybody unmuted because Dr. Ibrahim indicated that he's more than happy to take questions as we go. Just do me a favor for the sake of the audio. If you're not speaking, please mute yourself. And then feel free to, if you have a question as we're going along, to just interject, and I'm sure he'll be happy to answer. And also you can feel free, if you don't want to voice them, feel free to put them in the text box and we can go through them at the end. I just want to do a quick introduction of our speaker today. Dr. Ibrahim has held leadership positions within the healthcare industry for the past 14 years, most recently serving as Executive VP and Chief Physician Executive for Integris Health in Oklahoma. He also served as the Chief Physician Officer and VP of Medical Affairs at Mercy Health Network in Des Moines and Senior Vice President and Chief Physician Executive at St. John's Hospital in Springfield, Illinois. He received his Doctor of Medicine degree and his Bachelor of Medical Science degree at St. Christopher's College of Medicine and completed his internal medicine residency at Greater Baltimore Medical Center, which is an academic affiliate of Johns Hopkins. He also received a graduate certificate in organizational behavior and executive coaching from the University of Texas. He's a practicing hospitalist and is boarded in internal medicine and hospital medicine. He's a fellow of the American College of Healthcare Executives and a fellow in hospital medicine. He's held board positions with Autism Oklahoma, the Health Alliance for the Uninsured, and the Iowa Medical Education Collaborative. He's also the founder of the J. Christian Autism Foundation. So we want to welcome Dr. Ibrahim here today, and we thank him so much for taking the time to, Bassett is such obviously an integral part of our community, of our business community in so many ways. And we're so grateful to him for talking about the One Bassett vision and where it's headed in the future. So thanks so much.
Yeah, thanks, Tara. It's wonderful to see everybody, and thank you for taking time to join this conversation. As Tara said, I really would love to have this be a free-flowing dialogue. So at any point you'd like to interrupt, please do so. And I'm excited to share about, a lot of things about where Bassett is headed. There's a significant transformation underway across the organization. We've built a phenomenal leadership team that is really guiding the vision for the future. And I really want to just take a little bit of time to share, where we're going. As Tara alluded to, Bassett is a very, very important part of this region, of this community. And, in order for us to continue to fulfill our mission, we're going to have to strengthen, the operational as well as the long-term performance of Bassett to ensure that we can capitalize and deliver on that mission, given the fact that we are the central healthcare organization for, what is a 56 square mile region of geography. So, without us, this region, this community, all the citizens that populate this beautiful area would be detrimentally impacted, if not for a strong healthcare system. We're just about, you probably all, know some of the factual information, but just to kind of remind everyone, we have 5 hospitals, we have 2 nursing homes. We employ over 700 practitioners now that really staff and support this 5,600 square mile region. We have, over 40 or so healthcare clinics spread out across that area. And we do the very best to kind of try to support that very wide distribution. We're just about under $1 billion in net revenues, but the economic contribution that Bassett brings to this region is probably upwards of $2 billion in economic impact when you consider all the partnerships and affiliations and connectivity that we have across the Mohawk Valley and otherwise. So, we're very, sensitive to the fact that we are very important as an employer, as a healthcare provider, and want to continue to really be strong long term. So personally, I've been here, just about 9 months now. And over the course of that time frame, have learned a tremendous amount about the organization, about this wonderful community. Looking at this group here this morning, I've had the privilege of interacting with some of your businesses as well. And I'm looking forward to this summer where hopefully, we can continue to interact further and maybe even meet each other at some point in time. But it's certainly been an interesting year for all of us. And we hope that things start to open up here and lighten up soon. So without any further ado, I think what I'm going to do is drive into a presentation that I've put together here and really talk about the Bassett strategy. And as I mentioned, please do interrupt me. Hopefully you can all see that. Is that visible to you?
Yes. Yes.
Okay, perfect. Thank you. Maybe before I dive in, just kind of recapping a little bit about some of the early work that, my team and I have been doing to really lead into the strategic planning framework that I'm about to share with you. But, when I arrived back in July of 2020, I really spent a lot of time working with our boards, working with our leadership team to do a very thorough analysis and assessment of where the organization is today. Through that process, we had to make some pretty significant changes. Likely you've read and seen some of the highlights of those changes over the past several months. But what we've done is we've really moved to, in a very quick fashion, I really have to applaud our leadership team for the way that they've responded to the necessary changes. We've moved very quickly to begin integrating the healthcare system. And what I mean by that is if you look at the way Bassett has operated traditionally, we've been, what I would describe as a holding company model, where we had multiple assets, have multiple assets that, were loosely affiliated, but largely functioned independently. And, had certain processes, procedures, policies, operational and strategic plans that weren't necessarily fully coordinated. And we felt very strongly, actually, that in order for us to be successful in the new wave of healthcare and to be able to meet some of the challenges that we're seeing across the industry, that we're going to have to move very quickly to begin a very thoughtful integration process, to move from what we describe as a holding company model to a true integrated operating company model. Really everything that we've tried to do over the past, 9 or so months has been along that effort, is to really create that alignment, that synergy, that integration. So to that end, as I mentioned, we've really had to make some pretty tough decisions to really integrate. We had to challenge ourselves about, what is the best and optimal leadership structure for the organization. As a result, we've really consolidated leadership. We've built a single uniform executive leadership team that is now responsible to oversee the entire network. We've also built an executive operations team, which is responsible to operate the entire network. And as a result, have provided a lot of consolidation and centralization of multiple services across the organization to really begin this process to unify, to create uniform standards, to create uniform procedures, and a consistent, feel across the network, regardless of, where you interact with us as a patient. So that has been a very, very thoughtful effort. With that, again, came some challenging decisions that we've had to make to reduce leadership positions, to reduce staff, in an effort to try to drive towards an improved operational performance. And that was very, very hard, particularly in a small community like this, and given the economic impact that we know we have on the community, that was very, very challenging. Having said that, though, it was a necessary sort of precursor event that is really leading into the discussion today to help us target operational efficiency, to help us paint this vision for the strategic plan for the future, to ensure that we're here for another 100 years, like we've been already. So along those lines, let me just dive right in. Everything that we do, everything that we talk about today within our strategy really emanates from our mission. We take our mission very, very seriously, as I alluded to at the outset of this. When we look at Bassett, we are it when it comes to healthcare. There's no other competition within this region to really provide healthcare services. So we need to be strong to really support creating better health and wellness, which is, what our mission is long term. And everything that we do, again, emanates from our mission, vision, and values, including our strategy. So I aspire to this mantra of form follows function, and I think you'll see that throughout this presentation. We've gone through a really deliberate process to reevaluate that here internally. Our mission statement is what it is. It hasn't changed at all. It is the reason we exist. It's about improving the health of our patients and the well-being of our communities. That is why we're here and will continue to be here. What we did do, though, is we did modify our vision statement as well as our values. This was a really thoughtful grassroots effort by a very large group of our caregivers and practitioners who came together to really identify and try to outline what aspirationally we want to become. So our vision, what we aspire to be and do has been modified a little bit to really create a free-flowing statement that captures what we want to become. So through advanced integrated clinical services, education, and research, we aspire to be a model of excellence for health, creating remarkable patient experiences and better living. And I really want to point out that the latter part of this phraseology here around creating remarkable patient experiences, because that was something that was missing, from the previous vision statement. And our people have come forward and said, this is something that we are going to aspire to be and do consistently, is really focus more on becoming a patient-centered organization, creating, again, remarkable personalized experiences for our patients, and doing so in a very consistent fashion. We have a lot of opportunity to improve there. And I'd love to hear from the group at some point on your perceptions of the organization, but this is something that's going to be very, very important to us moving forward. Next, our value statements. So these are also brand new. Again, grassroots. Our people have come together and said, courage, unity, and excellence are the three values that we have to shape throughout the culture of the organization. This is how we do our work. This is what we want to become, and do so consistently. And along those lines, the grassroots effort, which included about 70 or so people across the organization, have started to also define through these value statements, how we actually display our values in action. I won't read this out loud to you, but you can see that it's very thoughtful, very methodical, and we're starting to really hold ourselves accountable to this. When we fall outside of the bounds of what we're standardizing for the organization, we call ourselves out on that, and we're going to be embedding these value statements and these values in general into our HR processes, into our evaluation processes, et cetera, to ensure every single one of our 5,000 or so caregivers across the organization are consistently modeling these values for themselves and for one another. So along the same lines, we have, sorry, there was a little bit of an echo there. Along those lines, we've also created a vision for the organization, where we want to go over the next 5 years. You're going to see some consistent themes here that connect back to this vision throughout this presentation. But the very first thing that we're going to be focused on is really internal. It's about our culture. It's about our workforce. It's really about driving that position to become a best place to work and practice. This is really focused on our people, and I've been messaging very regularly and frequently that our people are the most important asset that we have at the organization. That is something that I wholeheartedly believe in as the leader for the organization. And anything that we try to accomplish, whatever it might be, whether it's quality, safety, experience, growth, or any of these other strategies that I'm going to be sharing with you here momentarily, is not possible without a very strong and healthy and happy employee base. And that's where we're going to be investing really an extraordinary amount of energy and money to really support this strategy to engage and empower our caregivers so that they're happy here. They want to be employed with Bassett, that we can retain them long term, and really build healthy and prosperous, successful careers across the organization with a commitment to this community. So lots of focus going into this area right now and moving forward. Next, there really is going to be this intense focus on becoming a best-in-class care delivery organization. This really is a focus on quality, safety, and the experience, and becoming a top decile national performer. I fundamentally believe that if we can't get the fundamentals and the basics around quality and safety right, then we're in the wrong business. As a healthcare organization, this should be a given. Our patients, when they interact with us, they expect this. They expect to come to the organization and feel safe and be taken care of with high reliability, with superior quality outcomes. We have opportunities here to perform better. There's no question about that. We do well in some spaces, we don't do so well in others. But this is really about becoming a top decile quality performer across all of our outcomes. And doing so in a very consistent fashion. So a lot of focus going into quality, safety, and experience. Again, it's about developing our people. It's about investing in processes and resources to support this moving forward. Third is really, again, about becoming the preferred provider of choice. This goes back to that comment within our vision statement about creating remarkable patient experiences and making sure that we have more of a patient-centered, more of a consumer-oriented approach to how we take care of patients. This really is about creating convenience and going back to making sure that we have safe, accessible care across our network. This is another area where we have a lot of room to improve because, simply by the way that we're set up today, we've centralized a lot of our clinical services within Cooperstown. There's a lot of reasons for why that makes a lot of sense, but we've also taken away a lot of resources from some of these smaller, exterior communities that we are still a part of and very much want to support. So this is about looking at a thoughtful approach to creating more convenient access points across our network. It's also about meeting patients where they want to be met. So, how do we leverage technology in this world of digital and virtualization to really reach into not only the communities, but even into patients' homes to bring care to them as opposed to vice versa. We think that through this strategy here, we think that through creation of additional access points across the organization, an intense focus on that remarkable patient experience, that ultimately we will be the preferred provider of choice. Right now, we know we have a lot of opportunity to improve that. Right now, we see folks within our own communities actually out-migrate to other competitor healthcare organizations in the region. And, we need to reverse that trend to ensure that we can reestablish that patient-provider loyalty bond that I know Bassett can establish. So a lot of focus on our experience and making sure that we deliver a remarkable experience moving forward. Next is about really what the growth strategy of the organization needs to look like. We think that we can double easily within the next 5 years. There are a lot of opportunities presenting themselves, strategically now, and there will be more, particularly as more consolidation happens in the industry. The one thing that I will share with this group, though, is that we've put a staple in the ground to say we're going to be an independent healthcare system in this region. And what I mean by that is we're not looking to become acquired or merge with another large organization. As a matter of fact, our position is very counter to that. We want to strengthen our internal operations so that we could remain an independent healthcare system. We want to partner and affiliate with like-minded organizations, pursue value-based or risk-based partnerships with insurance companies to grow revenues in new and innovative ways, not necessarily focused on brick and mortar, but also look at what we can do nationally to really enhance revenue operations and efficient operations across the industry. So lots of exciting things that we're already exploring. In my experience, it takes probably a dozen things to be reviewed and analyzed for one to actually stick and occur. So we have a lot of things up in the air right now that we're reviewing that can really help propel this growth strategy moving forward. And then lastly, as you all know, not only are we a clinically advanced organization, but as our vision and our mission statements read, we're also very much committed to academics and research and education, and really driving the agenda for tomorrow's medicine, as I describe it, to educate and advance science in healthcare for the future. And we think that is the fundamental, important point that Bassett brings that can really help us become a national and an international player. The more that we can continue to be active academically, the more that we can continue to publish, the more that we can be, in the education and research game, the more that we're going to get the Bassett name out there in a very big way. So we're going to be focused on not only becoming a national organization, but also even consider international prestigious type of opportunities as well. So any questions on that before I move forward? That's a lot to digest. Just pause for just a second. Okay, Tara, I guess I can keep moving, right?
Yeah, keep on moving.
Okay, I'm going to skip that. Let me just go to what are our strategies now. Now that we've sort of created the vision at a high level, 30,000 foot view, try to distill it down a little bit into the actual areas that we're going to be focused on. You're going to see some overlap here, but that is the exact intent. So we have 8 Bassett strategies, and this is what we're really actively developing and moving forward with right now. The first 4 are bucketed into a category that I describe as strengthening the core, and this really is an intense focus on internal operations. It's a true understanding of what it is that are our core competencies and what we need to be absolutely good at to ensure the long-term success and viability of the organization. And the second bucket really is, around positioning for the future, which is more of a outward focused, agenda to really make sure that the organization is trending with the industry, that we're moving along the same lines as where healthcare needs to go, and remaining competitive in that space. So, I'll digest these one by one for you, but you're going to see a lot of overlap here. Under strengthening the core, the very first one is empowered and engaged workforce. Again, this is about my comments earlier. Really looking at our people, again, as our most important asset, investing in them, investing in their development, investing in leadership, investing in culture, and really driving that, that best place to practice and best place to work agenda. We have a lot of opportunity here. We have a lot of tactics that we're considering to really, make sure that we're competitive from a wage and benefits perspective, for example, to, again, invest in leadership, development programming, and all of those other things. So a lot of focus on this moving forward. The value agenda is really, again, connectivity to the safety and quality. The way I really like to describe this is, just kind of mathematically, believe it or not, if you just look at what true value is, all it is defined as an inverse relationship of safety, quality, and experience over cost. And if you look at that from a mathematical perspective, you could improve value if you just modify or improve safety, quality, and experience, and do nothing to cost. Mathematically, you would have an improvement in value. Conversely, you can do nothing to safety, quality, and cost, and safety, quality, and experience, and dramatically cut cost, and still improve the value equation. But what we're talking about here is really sort of a double-edged approach to magnify both, to really improve quality, safety, and experience, as well as driving a cost containment agenda that really creates value not only for the organization, but value that is ultimately translated down to the patient directly, so that healthcare is more affordable, more accessible, and our partnerships with payers, for example, are strengthened in the process. So this is, again, an intense focus on safety, quality, experience, cost containment, and ensuring that we're doing things as efficiently as possible. Next is accelerated performance and operational rigor. This really is as it sounds. This is an intense internal focus on efficiency. It's about becoming operationally, rigorous in all of our processes, ensuring that we don't have inherent waste built into our system. It's creating consistency and standardization, all of which will ultimately translate into better operating performance, better financial performance, that we can then, as a nonprofit healthcare organization, take those important investments and put them back into the organization, back into the community, back into our people. We've not been able to really do this too well over the past several years. As a matter of fact, Bassett has been losing money for the past half decade. And we need to really reverse that trend and reverse it quickly, particularly in light of what's happening in the industry right now in COVID. And I know you're all keeping up to speed on this, but the impact that COVID has had on healthcare has been astronomical. Had it not been for a lot of the federal funding pipeline that we've been very fortunate to take advantage of, we would have been in a very, very dire situation. So we're very thankful for that, but we're not out of the woods yet, and we can't depend on future funding mechanisms or future funds flowing to the organization. We have to take action, and we need to take action now to really embed operational efficiencies across the healthcare organization. And then lastly, I alluded to this, tomorrow's medicine. This really is a drive to focus on education, academics, research, and really shaping tomorrow's medicine. And we're very excited about that. So under positioning for the future, this is kind of the fun stuff. This is more future oriented, as it implies. It really is focused on investing in capabilities for the future. The first one is around tech-enabled consumerism and delivery innovations. This is about technology, digitization, virtualization. It's about coming up with alternative clinical care delivery models, not the traditional in-hospital acute care or primary care based, but it's about how do we look at telehealth, for example, and bring healthcare to patients' homes? How do we do remote patient monitoring and monitor chronic medical conditions longitudinally? It's about reaching into the communities that we serve and not vice versa. So we're going to be focused on this. This is probably more of a longer term 2 to 5 year range strategy, because it requires a ton of infrastructure and a ton of investment, but nevertheless very important for the future, and particularly where the modernization agenda across the country is taking really every industry. Healthcare and millennial sort of generations are looking towards this as being how they interact with healthcare long term. So we're going to have to respond to that and do so very importantly. Purposeful and intelligent growth, also, as it sounds, is really that. It's about how do we grow intelligently and purposefully. It's not about growth just for the sake of growth or acquisitions just for the sake of acquisitions. It's about how do we continue to advance our mission? How do we improve business operations and pursue profitable business lines, and really continue to support the organization's not only bottom line but the mission. And there's a lot of exciting things happening in this space right now that I can't share with you, but we are definitely going to grow, and we're excited about that. Managing populations and payment capabilities. This is the future of medicine. If you've already heard or read, healthcare has already been on this journey to move from what is described as a fee-for-service model to more for a fee-for-value model. And what that means is there's going to be a very significant drive to reduce sort of this episodic care reimbursement system that we are currently in today, which really build in the incentives to drive more services and more costs up to more of a value-driven approach where we're paid differently. We're paid to improve outcomes. We're paid to improve quality. We're incentivized to actually reduce healthcare encounters, but at the same time promoting health and wellness. So that is a very significant paradigm shift that the industry is going through right now. And it requires a lot of capabilities. It requires a lot of internal investment to really support us managing populations, taking care of whole groups of people, like the groups of people that we take care of within this 5,600 square mile region. And there's a lot of interesting and innovative programs coming out of the federal government now to begin really advancing this. And if we've learned anything in healthcare over the past century, is that when CMS or the government actually begins to move in a specific direction, every other healthcare insurer or payer in the industry immediately follows suit. So we can expect to see a lot more value-based reimbursement coming upon us here in the near term, and it already has started. And then lastly, mission-driven partnerships and affiliations. This really is an internal sort of drive to reconsider our previous position about being everything to everyone. we know that we're not going to be the best at every single thing out there, and that we need to leverage partnerships and leverage other organizations that are of like mind, who are consistently, aspiring to the same mission that we're aspiring towards, who can bring more value to the organization and more value to the community. So we're going to be doing a lot more in terms of partnerships and affiliations, and have some exciting things happening in this space as well. So you'll be hearing about some of the partnerships that we're going to be announcing shortly. So that's really the strategic framework. That's the playbook, if you will. And what we've done, within each of these, and I won't go through each of these slides because there's a ton of information here, but just to kind of give you a picture, within each of these strategic priorities, we've gone in and we've begun to really outline what are the key tactics, what are the incremental steps that we're going to have to take to really drive this vision and this aspiration within this global strategy. You can see some of the key tactics listed out here, but we've also taken it a step further because you don't improve what you don't measure. And we've built out, key performance indicators and the key outcomes that we need to be watching regularly and driving moving forward to ensure that we're making incremental progress towards this aspiration of empowering and engaging our workforce, for an example. So we've done this really for every single global strategy that I've outlined here for you, and all put together, really this does create what Bassett's strategic plan is going to be over the next 5 years. And we're very excited about it. We have phenomenal leadership engagement right now. We have great board engagement in support of this. Our board just formally approved this plan last month. And now really just becomes about execution and delivering. And we're very excited about the future. So that's a lot. That's a lot of information, but it really, I think, is an exciting time at Bassett. We still have a lot of work to do, and I think we have the right people now coming together to do it. And the community, support around this is going to be critical. It's been there certainly since my arrival on day one. I know it's been there before that, but the support that I've seen from the community and folks like yourselves over the past 9 months has just been inspiring to me. And knowing how important Bassett is to all of you, me and my leadership team were very committed to ensuring that we execute on this plan and we deliver long term. So with that, Tara, I'm happy to stop and take a lot of questions or just engage in any conversation. I'd also love to hear from the group, anything that the group would like to share relative to your perception or your experiences with Bassett, and any potential opportunities for improvement that you see. I certainly would be open to discussion there.
Thank you so much. Does anybody have questions that they'd like to ask?
I do.
Okay, go ahead, Michael.
Yes, thank you for joining us today, Dr. Ibrahim. I hope I didn't butcher that.
Tommy's perfect.
Okay, great. First off, I think without Bassett, without baseball, financially the area wouldn't make it. So I think Bassett is an amazing organization. I'm a local financial advisor, and I work with dozens of providers, from PAs to doctors to NPs, what have you. You mentioned that obviously the goal is to invest in people and continue to recruit. And one thing that I help those folks with is student loan forgiveness programs. A lot of these folks don't know that if they have federal direct loans, they can actually have them forgiven if they work for a nonprofit such as Bassett. And over the years, I've just struggled with getting in contact and presenting that to the folks. So is there a way that I could potentially do that? Is there anyone that you could connect me with to kind of set that up as a Zoom presentation?
Yeah, no, absolutely. Michael, we'd love to entertain that kind of discussion. As part of our executive leadership team, we've appointed a chief people and diversity officer. Right now, we have an interim person who's really leading all of the HR efforts across the organization. I think that would be a really good conversation for you to have with Christine Peary. We also have some folks on the Bassett Medical recruiters, particularly, who would also, I'm sure, entertain that conversation with you as well. So if you want to reach out directly to me, I can get you plugged in and connected and, initiate that conversation. Thanks for bringing that up.
No problem. What's the best way to get in touch with you?
My email, or Tara, I'm sure Tara can give it to you.
Okay.
Yeah, send me an email, Michael. I'll connect you.
Thank you very much. Thanks for your time.
Absolutely. Thank you.
Does
Yes,
anybody else have a question?
Stephen, I think.
I do.
Go ahead, Stephen.
I'm Stephen Malum, and I've been involved in the Cooperstown community for several years. And it's obvious, as Michael noted, Bassett is absolutely critical to the health of the Cooperstown economy and the surrounding area. Is there anything that we as a village or we as a broader community can do to assure that we provide the support that Bassett needs? I know one of the concerns over the years has been, well, if Bassett were to pull, maybe if Bassett can't get the labor, the skilled labor that they need in the village, for instance, for administrative purposes or for any support, that Bassett might move those support services to Utica or some other area where there might be more people. Is there anything that the village can do in terms of infrastructure or in terms of helping Bassett to make sure that in the long term, we provide whatever infrastructure and whatever support services Bassett needs to be successful and Bassett needs to continue to be Cooperstown focused or based?
Yeah, it's a really good question, Stephen. And the answer is absolutely yes. I mean, there's a lot that we can do together for sure. I think understanding all of the businesses in the community, going back to my global strategy around mission-driven partnerships and affiliations, understanding what the resources and the capabilities are in the community today, and how we could potentially share resources, how we could potentially leverage our respective strengths to really position this community for long-term success, I think is always a good conversation to have. And we've started doing something like that. For example, with the Otissaga, for example, and the Hall of Fame. Those are important businesses that we always try to see if there are synergies or alignment capabilities, with those businesses. So I would say that's one. In terms of our recruitment, you're absolutely right. This is a challenging area to recruit to, which I don't understand. I think it's gorgeous. It's a beautiful, idyllic place to live. But having said that, it is not the easiest place to get people to come and commit to long term. We recognize that. So we are challenged in terms of recruiting and maintaining and retaining nurses and physicians and other support staff. So that is always a constant struggle. Interestingly, though, we've had a good year. COVID was actually played out very positively for our organization from that perspective, because we saw a lot of folks actually out-migrate from metropolitan areas to more rural areas like ourselves, which actually played out very nicely for us. So we're doing better in that regard. As we're thinking about incorporating virtual, digitization really is expanding organizations to be able to reach globally, right? So we can really reach and bring people in virtually from anywhere in the world now, which is quite amazing. We're definitely going to continue capitalizing on that. But I think to really answer your question, Stephen, where the community can really help Bassett is to really be a voice for some of the really challenging work that we have ahead of us, and to be able to speak to that in the community, to support that in the community, and to really stand behind I think the strategic plan that I shared with you here today, which has been fully endorsed by our board of directors. So it's not going to come easy. It's going to take a lot of time. We're going to fumble along the way. There's no question that we're not going to get everything right. But I think to have the community support and all the businesses support the general direction of the organization and to vouch on that is going to be critical. So I'd say that's probably my biggest ask. I hope that answers your question.
No, thank you.
I have a question, Tara.
Go ahead.
Cindy Waller, Art Garage on Beaver Meadow Road. My understanding is that it is rather difficult for Bassett to find enough housing for doctors and nurses and technicians, and that one of the issues has been that so much of the housing stock has been taken up by short-term rentals. And would you address that problem and how we might help?
Yeah, it's a great question, and it is an absolute issue for us. A lot of the folks that work at Bassett, particularly Bassett Medical Center, don't live in Cooperstown. They come from outlying areas. We don't even have enough parking spaces for all of them, and have to shuttle them to the hospital. So it is a very challenging situation. Having said that, there have been some strategic plans that have been contemplated, mobilized to build out more capabilities in that regard, to build more housing options. And we're exploring, relationships with banking institutions right now to be able to fund several projects in that regard. I think we also need to look beyond Cooperstown proper and look at other sort of regional areas. With the land mass out here, we should be able to address this. It's definitely a longer term strategy, but something that we need to do for our people for sure.
Thank you. And related to that, you probably know broadband becomes a big challenge as one lives outside of the village. Mm-hmm. Is Bassett actively involved in advocating for better broadband out here?
Absolutely. There's with this historic new, American Rescue Plan Act, which, is really a $1.9 trillion pool of funding. There is a significant allocation towards that, towards broadband within that. And we are very, very active in this space to work with our lobbyists, with our advocacy organizations, to chase as much of that as possible. We're not going to do it alone. We have to partner with telecom communications companies, other infrastructure related companies, and invest in not only broadband fiber, application and capability, but also look at cellular and satellite, coverage and other, such technologies to really take a very comprehensive approach to addressing this issue. Everything that I mentioned around virtualization and digitization and sort of the technology enablement that we're looking to drive in the future hinges on this particular point, right? So it's a very, very important topic and subject. We want to reach people in the home setting, but we're not going to do that if they don't have internet. And even if they do, one of the other problems that we're going to have to address is, although they may actually have the infrastructure, they may not be able to afford it. So there are inherent challenges, and there's several monies out there, grants and otherwise, that can really help, and we're definitely going after it very aggressively.
Great, thanks.
Yeah.
There's another question in the chat about housing, but I think you addressed that. There's another question about how is Bassett contemplating adjustment to climate change as far as things like energy consumption? Yeah,
that's a really good question. It's quite honestly, it's not something that, we have been enormously focused on. Certainly there's a lot of conversations internally about climate change and how we could really continue to, get more green and be more energy and environmentally conscious. And we have, some great projects underway. But at this point in time, nothing that I would say is, increasingly transformational in this space. We have looking at programs to embed more solar, to go more towards, LED lighting, for example, across the entire organization, and, reduce energy consumption that way. But there's still so much more that we could be doing along these lines. But we're going to be focused on this after we get through some, I think, really other important priorities that we just need to get behind us before we can really invest time and energy and money into this space.
I have more questions if no one else does.
There's one more in the chat. What are the expected net count forecasts for growth in the short term and in 5 years locally here in Cooperstown and in surrounding networks and affiliates?
That's a great question. So if I understand it correctly, this is about job creation. Is that correct, Todd?
Yes, it is.
Okay, so I mean, I think you could probably surmise that if we were to really double, that we would probably have a net 100% increase or so in the number of FTEs across the organization, give or take. We think that we are operating at this point in time relatively okay. We might be a little bit on the superfluous side. But by and large, I think if you look at today's operations and doubling, we would go from 5,000 headcount to probably closer to 10,000 headcount, which would mean significant growth. So we want to, create jobs in this region long term. That is a commitment of ours. There are some very important growth markets that we're going to be going after to really solidify our position here long term. And I would expect that, particularly in surrounding areas, we would see a lot of job creation.
Awesome. Yeah, we've got a store here in Riverwood in Cooperstown. And so just so you know too, like all of your patients and all of your employees, we have something called like the Customer Awesomeness Program. So our store, we're a retail toy store, gift store. So everybody would be available. Anybody who comes through once a year gets 10% off our entire store. So that's something that could be added to your benefits. And also, we also rent out our house as well. And so I think the market for, having a visible market rather than just potentially an email contact for like reaching out to try to rent your house, I think that could potentially be improved, and then the employees in the local areas could probably benefit as well.
Yeah, that sounds great. Yeah, I would encourage you to reach out to me as well, and I can connect you to our folks internally who can maybe help with both of those items.
Awesome. Yeah, thanks. Appreciate it.
Absolutely.
There's another question. It's more of a general question. For your stance on the question is, are you pro or against universal healthcare as we know of it in Europe?
Oh wow. Okay. I don't want to get political, but there are pros and cons to both. And I'll probably just kind of leave it at that. But you can see inherent strengths and challenges with the way U.S. healthcare is operated and run. But you could also see inherent pros and challenges with how universal healthcare is run, relative to access and quality as well. So, it really is something that I think is hard to answer. I do know that in the U.S. particularly, we definitely have a lot of opportunity to improve. But if I were to get healthcare, if I needed healthcare, a member of my family needed healthcare, I would want to be treated here in the United States of America.
There are just a couple comments that I'll read, more so commentary than questions. But one comment was, there are many senior physicians, staff members that are near retirement age, linked to an organization that would send fellows to Bassett as a rotation, would help with resident training and potentially recruiting. And then there's another comment about the importance of local school districts being critical to successful recruitment efforts, and how lack of broadband and connectivity, especially with remote learning during COVID, is creating a disparity with learning for households not connected. So just some additional commentary there.
Yeah. Thank you. That's right.
Any other questions for Dr. Ibrahim this morning?
Yeah, one specific question. This is Stephen Malum. If Bassett grows, if Bassett doubles in the next 5 years, do you have any feeling for how much of that growth would be specific to Cooperstown or even Otsego County versus the surrounding counties?
Yeah, so largely I would say probably surrounding counties. Quite honestly, that's not to say that there isn't additional opportunities to grow here in Cooperstown. One of the things that we are exploring right here in Cooperstown is how do we go from double bed occupancy right now in our hospital to single bed occupancy. What I mean by that is single bed rooms, in order for us to go to single bed rooms, and still be able to have the same capacity that we provide today, we would have to build additional infrastructure. That would mean, more growth here in this area, more services that we would like to ensure we put, within Cooperstown, and build all the feeder systems that would help support this strategy of expanding the hospital capabilities. So we would see certainly centralized, growth here in Cooperstown. This is going to always be the hub, right? And all of the clinically advanced capabilities that we are very proud of and want to continue building upon will always be right here in Cooperstown. So we can certainly count on that as being a staple for this community long term. But in terms of the 2x growth, we're not going to double here. We're going to be interested in markets like Binghamton, like Utica, like Syracuse, like Albany, virtual markets, which are expansive, as you know, and growing in that regard as well.
There's one other question in the chat. With Bassett hiring international nurses, how are we acclimating them to the community and working with the communities to educate and appreciate the diversity that this creates?
Yeah, it's a really good question. We're very proud of our international nursing program. We've been very successful so far with that program. We've had a hard time getting housing for them, to Sydney's earlier point, but we've made some good progress there as well. We do celebrate that diversity. We think that is very important for the organization. As a matter of fact, we're actually in the process of recruiting a vice president for diversity, equity, and inclusion across the network. That is going to be a senior leader role to really promote this culturally, across the network. And we're very proud of that fact, but we still have a lot of work that needs to happen in that space.
I can speak to that a little bit from the business community side. The chamber, for example, we've looked at, we're currently executing some relocation packets to help acclimate new hires to the community. And I know there's some other thoughts in the community about initiatives and undertakings to help the international hires also. So there's also some work on the community side going on that.
That's great.
There's one other question. Bassett was at the forefront of establishing NICAM in the 80s. Is it contemplating establishing new centers that address issues of rural poverty or addiction?
Absolutely. It's a really good question. When we talk about, our seventh strategy, managing populations and payment capabilities, it really gets to the heart of addressing healthcare disparities as well. And rural populations are absolutely a part of that. Impoverished populations are absolutely a part of that. Mental health and addiction are absolutely part of that. But each of those populations really require a different set of core competencies and a different set of core strategies, if you will. But those are the kind of capabilities that we are contemplating and actively trying to build right now. They require investment. They require a lot of energy and support. But we're marching in that direction to make those investments here over time, so that we can build that infrastructure to support these kinds of populations in the community. So the answer is absolutely yes. We're very focused on what is largely labeled as social determinants of health. And we know if we don't address these social issues, it's going to be very hard for us to meet the mission of promoting health and wellness in the region, which we're here to do. So I hope that helps.
Jim, did you have a question?
I do, Tara. Jim and Polly Rankins, we've been patients with you guys since '71 and still are very active with the hospital. And one thing that bothers me, I think, Tommy, the first time many people come in contact with you is dialing 607-547-3456. And when they have to wait 15 to 20 minutes for someone to answer the phone, I'm sure that must upset, scare, put fear in people's hearts about how efficient the organization is. And I'm sure there's some logistics involved in it, and we love it and we hang on. But I'm sure there's something that if you could work on one thing to affect, I think, immediate feelings to some people, might be that answering system in the beginning, which to me sometimes turns a lot of people off. But other than that, we love you guys and we're here for you. But that always throws me to this day.
Yeah, I'm so glad that you brought that up. I hear that consistently, as I can interact with the community, as I interact with with donors, as I interact with board members. This has been a very consistent theme, across the board. And we are actively focused on this, and I can assure you we will be addressing this. We have some really exciting things in the works right now to restructure our call center, because you're right, there are operational and logistical inefficiencies built into how it's structured today. Having said that, we're going to fix it. It's going to, again, take a little bit of time, but I would hope within the next 6 to 12 months, there's a tangible improvement in the perception, but more importantly, in the way you interact with our healthcare system. So we will fix this, I assure you.
Thank you very much. Enjoy your 6 Mile Point stay.
Thanks. Thanks.
Any other questions at all?
Okay.
I think we're good. Thank you so much, Dr. Ibrahim. We really appreciate you answering all these questions today and your time this morning and all of your commentary. We're very much looking forward to seeing where Bassett goes in the coming months and years. And thank you so much for all of your work.
Yeah, appreciate you guys. Appreciate the opportunity. I hope to meet all of you at some point in time in the near future, and look forward to our work together. So thank you.
Thank you. Okay, have a good day, everybody. Thanks for joining us.
Thanks, Tara.